yeah, why do you have this?
I don't know. That's the whole point of asking. I got that weird like alert thing, and then like, my phone went on the fritz, and now I can't even shut it off.
Oh yeah.
It was throw it probably.
Oh yeah.
Or stop.
That's, oh my gosh, I don't know why.
Yeah.
Okay. Well, I don't know. I mean, I need to get out of the heat.
It goes.
But yeah, no, that's that. I don't know why it's
Got to request a truck.
Oh, okay. Yeah, so I can't even get to the set.
Hi, nice to see you again. Nice to see you. I wish you could hands. I have like no hands.
Hey, Joel.
Good to see you again.
Hey, Dylan.
Hey, Dylan.
One of the new guys at Fox.
Hey, nice to meet you.
Yeah, you too.
Thanks for coming out this morning. Sorry it's bad news, but you know, we'll kind of talk through a little bit about it. I can tell you what it means.
The challenge is the shade.
Yeah, we stay like partially shaded or
Come this
fully
way, maybe,
off.
right? What about there? Is that cool with you guys? Yeah. No, I think you're good. All right.
Well, good afternoon, everybody, and I'm Richard Bruno, Health Officer at Multnomah County Health Department, and I come to you with some sad news this morning. We have had 3 suspected heat-related overdose deaths in the last 3 days, so people who have potentially died of heat-related illness. And so we wanted to tell you a little bit about what we can about some of those suspected deaths, and then talk to you about how we can prevent future deaths from happening for the rest of this heat-related illness, heat-related events. So yeah, our Multnomah County Medical Examiner's Office is investigating 3 suspected heat deaths of Multnomah County residents since the state of emergency was declared on July 5th amid dangerously hot temperatures. The first death suspected as connected with this emergency was an 84-year-old man in the 97230 zip code, and that was reported on Friday, July 5th. The second death was a 64-year-old man found in the 97206 zip code, and that was reported yesterday, Sunday, July 7th. And a third death was a 75-year-old man found in the 97216 zip code, also reported on Sunday, July 7th. Additionally, on Saturday, there was a 33-year-old man transported from outside Multnomah County where he died from suspected heat-related illness at a Portland hospital, and this individual was not a Multnomah County resident. So no other details are being released or available at this time, but all the deaths are still considered suspected cases or under investigation as potential hot weather-related deaths. Confirmation won't be complete for several weeks to months, but further tests and investigation will determine whether the deaths are officially hot weather-related. In some cases, the death may be found to have other causes. So we'll update this information as soon as it becomes available. And with any tragic losses in our community, we turn our focus on preventing further deaths and by helping people beat this heat over the next few days of this excessive heat event. We have 3 cooling centers that are open today from noon until 10 p.m. And we have also extended our library hours until 9 p.m. The splash pads are open, the public pools are open. And if people have trouble getting to one of our cooling centers, they can call 211 and arrange for transportation to the cooling centers. We also have mobile medical vans that have been available at the cooling centers. We had our Multnomah County medical van was there on Friday. We had Central City Concern had a mobile medical van on Saturday and Sunday at these cooling centers, and they were able to see patients who needed medication refills, needed to be seen for wound care, and other types of medical concerns. So we're very happy to be partnering with Central City Concern on those efforts. Today at the Behavioral Health Resource Center, we have our Multnomah County mobile medical van outside. This is one of our routine spots that we come every week. And so they're available to see people who need medical care as well. And so we're just asking the community and society to come together. We really want to try and encourage people to check in on your neighbors and your friends and your family members, people who may be at risk of having a heat-related illness. Check in on them, make sure they have a heat plan, make sure they got their AC going if they don't already, make sure that they're turning their fans on and getting some cool air circulating. And so encourage everybody to do outreach. We'll be doing outreach as the county as well, so we'll be calling some of our more vulnerable residents to ensure that they have a plan as well offering the cooling centers and other spaces for people to get cool.
When will we know if the people who died were unhoused or were they inside apartments?
Yeah, as we are able to do more confirmation, we'll be able to release more about what their particular situations are in, but typically that comes later.
Is there concern, obviously, from the county it's going to get worse before it gets better? Obviously, these temperatures are still going up the next couple of days.
Yeah, today's the highest temperatures that we're predicting over this heat event, and could be even hotter tomorrow. We meet every morning with the National Weather Service to determine what the probabilities are. I know your teams all have meteorologists too that are keeping you up to date on these, but we're wanting to make sure that we're preventing future deaths and future heat illnesses as well.
With nighttime temperatures still going to be in the 80s around 10 o'clock, why not have the cooling centers open overnight?
Yeah, today the decision was made not to open overnight, and that was based on a number of factors. It will be getting into the upper 60s or 70s tonight, giving people a little bit of a respite, a little time to cool off. So we are not going to be opening overnight tonight, but we'll reevaluate in the morning, see if we need to open up overnight tomorrow night.
From a health perspective, if the body isn't acclimated to extreme heat, like we've seen recently with temperature jumping to triple digits, does that change anything? Does that create greater risk?
Yeah, absolutely. You know, everybody has different ways of thermoregulating and adjusting their own temperatures, but we're particularly concerned about people who have chronic diseases like heart disease or respiratory diseases. We're concerned about our infants and young children, as well as the seniors in our society. So those are folks we're really trying to make sure that we have a good plan for, and make sure that they have the ability to get cool someplace, stay cool throughout the day, and also cool down at night.
Is the county doing anything different now that we have some reported deaths?
Yes, we are. We are actually taking a look to see what types of heat-related events and people who are at higher risk. We're continuing to make more and more phone calls, doing more and more outreach, trying to highlight and focus our attention to make sure people have a plan, have the ability to get to someplace cool, and we're ramping up our transportation to these cooling centers as well.
I know that the investigation is still ongoing, but can you talk about any themes maybe you've seen in these deaths? Dehydration or sun exposure? Is there anything that happened to these individuals that was consistent during this?
I wish I could draw a thread there. I just don't have enough information at the moment to be able to connect anything. But certainly, you know, of the folks who passed away of suspected heat-related illness, you know, these are probably preventable deaths. You know, based on the fact that we assume that they probably would not have expired if they had had better cooling options. And so we're trying to ramp up and make sure people have those options right now.
One of the lessons learned from the 2021 heat dome is many of these people who passed away lived alone, were isolated. And you touched on this earlier, but maybe you can reinforce the point of what can the community do, what can neighbors do to prevent tragedy from happening again?
Yeah, absolutely. If you have an elderly neighbor, if you have somebody that is your friend or your family member who is staying alone, who doesn't have access to fans or air conditioners, please give them a call. Please check in on your neighbors. Let's pull together here and try and save folks.
And you kind of just hit my last point, but I wanted to ask, obviously, this is still ongoing, but there was a commonality I noticed. A lot of these, at least 3 of the 4 gentlemen, were over the age of 60. Can you talk about the outreach that you guys are doing and maybe the vulnerable groups that you are focusing on?
Yes, absolutely. So we are able to take a look at folks that have known medical conditions, chronic diseases, things that may put them at higher risk of being susceptible to heat-related illnesses. And so those are folks that are high on our list and prioritized, as well as seniors in our society for sure. I also want to let you know today we're declaring it a red day, which means that we have more ground level ozone today than we have had previously. There's a burn effect in Multnomah County, so we're asking people not to burn things out in the community because with low level ozone, ground level ozone, it can be very harmful for people who are trying to breathe, especially for folks who have respiratory diseases or our youth or seniors. And so we're asking people to respect that burn ban right now so we don't add to the additional ozone.
Hey, it was a pleasure. Thank you. No, it's okay. Don't worry about it.
Thank you so much.
Yeah,
Thanks for taking the time.
yeah, for sure. And if y'all want to get any footage of our van, it's around the corner. It's called Wheelie McKeely. It's our mobile van. The new thing we're rolling out. So it's rolled out. And it's been really amazing to be able to provide this kind of medical care.
I know that when we talked last week, you were saying that they're going to be treating heat-related illness. Are you guys seeing a lot of that at the cooling centers?
Oh yeah. A lot of folks coming in pretty dehydrated looking. We haven't had to deploy any 911 calls yet. Nobody like serious level. But we're keeping an eye out. So today will be hotter than it was yesterday. Yeah.
Thank you again.
Hey, appreciate you.
Should it get shots of the van? Yeah, that is. Walk around the building.
Yep, that's the same one.
Did you try turning it off?
Yeah, but it's not.
I'm saying if you're trying to turn off like some emergency service. They love each other. Yeah.
For events like this.
Or we might not be.
Because that's
Mental, physical, talking to each other. Really all. I have it on this.
Well, it is a good lesson. Like,
I mean, that was,
people don't like to like act on neighbors necessarily, but it's like they don't know how to like that.